Hello everyone, welcome back to channel GDC English. So in this video, we're going to have another video lecture of the series Pharma Twins. Similar soundings, but different actions, right? So here we do have a new set of drugs. That's your Carbamazepine and Chlorpromazine. And when I heard for the first time when I was studying for the GPAT examination, I used to think like, oh, these are same. I used to mix up the adverse drug reactions of these two drugs. So make sure you remember all these things, which I will be telling you into the separate bases. Okay. So here it is what carbamazepine and we do have chlorpromazine. Just because they do belongs from the same um, actions, not actions, I can say same system, right? Because these two drugs are going to act on the nervous system, obviously, right? So that's why I used to mix up all the things between these two drugs. Okay, so let's go on to the first one, that is a class of these drugs, anticonvulsant mood stabilizer. Carbamazepine is being used in your epilepsy, seizures may these are being very much useful, also useful as a mood stabilizer. Whereas if I talk about chlorpromazine, these are a typical first generation antipsychotic drug, which is of your phenothiazine derivative, which is very much important, already asked that which kind of derivative it is, right? That is your phenothiazine derivative. Typical first generation antipsychotic. Antipsychotics are the one which are going to decrease down the dopamine level, okay? Now, so let's talk about the primary use. Where do we use it? Carbamazepine as well as chlorpromazine, right? So primary use are nothing but seizure disorder, that is your partial as generalized tonic-clonic seizure. Okay, partial and generalized tonic-clonic seizures may be used carbamazepine. It is a drug of choice for partial seizure. In plenty of examinations of comparative examinations of pharma, I have seen this question that carbamazepine is being useful in which of the following seizure? That's your partial seizures. Okay, so this is very much important. Trigeminal neuralgia, drug of choice for that. Drug of choice. Bipolar disorder, mania, just because it is being used as a mood stabilizer, right? Neuropathic pain, neuropathy, peripheral neuropathy. These are the conditions where carbamazepine is being used, right? Where if I talk about chlorpromazine, that has been used in your psychotic disorders in which dopamine level goes very much high. So to decrease down the dopamine level, we do have antipsychotic drugs. In one of that, we do have phenothiazine categories, chlorpromazine, schizophrenia and other psychotic disorders, severe agitation, right? Mania, intractable hiccups, uh, 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 right? These are your hiccups. And antiemetic pre-operation, these are being used. That is what? That is nothing but which is your pre-anesthetic medication. Okay, pre-anesthetic medication. As a pre-anesthetic agent also, we use this chlorpromazine. Okay, now let's talk about mechanism of action, that how it usually acts on, right? So since this is a carbamazepine used as an anti-epileptic drug, anti-seizure drug, so it will be using onto your sodium channels, blocks voltage gated sodium channels, stabilizes hyperexcited neuronal membranes, and decrease the repetitive firing of your sodium, right? Where if I talk about this chlorpromazine, since it is typical antipsychotic, first generation antipsychotic, so that's why it has been acting onto the dopamine, whereas it is also acting onto some other receptors, for example, alpha-1 muscarinic receptor as well as H1 receptors, but these are being used particularly acting onto the D2 receptor antagonist, okay? Antipsychotic effect that has been used through dopamine receptor, but also blocks alpha-1, H1 and M1 receptor. So just because it is acting onto the M1 receptor blocks that, so it do have anticholinergic action. Anticholinergic action. Okay, so make sure you remember this one. Multiple CNS as well as autonomic effects it do contain. Dosing, you know, the 200 to 400 mg 2 to 3 times daily, and 25 to 100 mg 2 to 3 times daily. These are also being required. Okay, now major adverse effect, very much important. Major adverse effect, Hana. Plenty of time they used to ask questions from the adverse drug reactions, right? What is that? Dizziness, drowsiness, ataxia, diplopia, two visions, right? Diplopia, nystagmus, hyponatremia. Hyponatremia is nothing but syndrome of inappropriate antidiuretic hormone secretion, in which antidiuretic hormone doesn't even secretes, right? So that's why. Leukopenia, aplastic anemia is rare. Rash, SJS, very important. SJS is nothing but Steven-Johnson syndrome as well as TEN. TEN nothing but your toxic epidermal necrophylactic. Okay, necrophylaxis. Okay, rash, SJS, Steven-Johnson syndrome, and 10 toxic epidermal necrophylaxis. These are your skin disorders. All these three things, rashes, SJS, and TN. And that is particularly seen in those persons who have a gene number of HLA-B star 1502 in Asians. Okay, as well as teratogenic. Obviously, carbamazepine can cause teratogenic effect. That is nothing but your neural tube defects. If you remember, neural tube defects, right? Neural tube defects, it can cause your carbamazepine. Where if I talk about chlorpromazine, the sedation, just because it crosses the triple B M1 receptor, anticholinergic, so sedation it may cause hypotension just because of the alpha 1 blockade. So postural hypotension can takes place, right? Extrapyramidal syndrome, obviously all antipsychotics which are typical ones can cause your extrapyramidal syndrome, which can lead towards the Parkinsonism disorder. Just because dopamine level will going to be decreased down in a drastic way, so EPS can be produced over there. Maximum EPS producing drug is an antipsychotic, that is a haloperidol. Okay, now tardive dyskinesia, anticholinergic effect, just because it is acting on the M1 receptor, dry mouth, constipation, urinary retention, photosensitivity, as well as jaundice, this can also takes place with this one. Monitoring CBC, blood dyscariasis, LFT, serum sodium carbamazepine level, therapeutic 4 to 12 mcg per ml. That is your monitoring that can be done for this one. Whereas if I talk about chlorpromazine, watch for EPS, extrapyramidal syndrome, tardive dyskinesia, BP, orthostatic hypotension. That's I already told you, just because of the alpha 1 blockade, right? LFT, rare, cholestic jaundice, and CBC, rare, leukopenia can occur with that. Okay, drug interactions. Carbamazepine is a potent enzyme inducer, GPRS cell phone, if you remember, right? This is your CYP3A4 inducer. So it's going to be decrease the levels of other drugs, for example, whichever it is being given with the interaction, right? For oral contraceptive, warfarin, DOACs, steroids, these are being acting, which are interaction with your carbamazepine, these are going to decrease down those levels of those drugs which are going to be useful in combination with this carbamazepine, right? It is also avoid with MAO inhibitors just because of the risk of toxicity. MAO inhibitors, selective MAO inhibitors, selective MAO A, MAO B inhibitors, it can cause your cheese reaction as well. So make sure you remember this one. Okay, chlorpromazine, additive CNS depression, alcohol as well as benzodiazepines, these are the drug interaction with alcohol. If they would have taken with benzodiazepine, so CNS depression may be prolonged. Hypotension with antihypertensive, anticholinergic effect with other anticholinergic. So it may potentiate all those actions with antihypertensive as well as anticholinergics. So this is important, right? Now, what is the mnemonic to understand? Carba controls the neurons, that is your carbamazepine, anti-seizure as well as mood stabilizer. Chloro calms the psychosis, chlorpromazine, antipsychotic drug. What is the main thing over here? Carbamazepine is your anticonvulsant drug, sodium channel blocker, seizures, neuralgia, and bipolar disorders it is being used. Chlorpromazine, which is an antipsychotic nature, D2 blocker, phenothiazine category. Psychosis it is being used, mania, hiccups, as well as nausea. Okay, so this is all about your carbamazepine and chlorpromazine. Seems to be like twin, but they do have a different nature. Stay tuned for the upcoming video, guys. Thank you so much for this one.